Wikidonist.com. Truth about tooth.
Pregnancy is one of the best times in human life. To be a mother and to know that there is a baby which is growing inside you is one of the most blessed times in your time. But during that time, there is a lot of mental and physical changes in your body. The physical changes is basically attributed to, or bodily changes is basically attributed to the hormonal changes which is happening inside, so that the child grows in the right way. So there is a lot of changes which is happening, and in most movies we have seen that the first sign is to have a vomiting scene, where you might have seen in the movies they just have a nausea and then they understand that okay, this lady is pregnant early in the morning. And most of the ladies or most of the girls who are pregnant who will have this problem of morning sickness. This morning sickness has always given them an idea that they should not brush in the morning. If when they brush, it is even more. So most of the time what happens is these people neglect, the young women especially will neglect the brushing. So since it is a neglecting of brushing, they will go on into the normal chores, and that's the only time they used to brush. Most of the people brush only in the morning, and they have neglected the brushing, and then it causes a lot of dental caries, dental infections, dental gum issues and things like that. So that is one of the major reasons why during pregnancy most of the people have come up with dental issues, especially dental caries, dental pain and gum issues. So why is it? Is because they have, in the first trimester especially, when there is a lot of nausea, there is a lot of vomiting, people tend to keep off brushing of teeth because they cannot keep anything in the mouth, and then they start having nauseating problems and things like that. So they avoid brushing, and then they get into all these troubles. The second reason is actually the vomiting itself, because in vomiting itself what happens is there is a lot of gastric juices which is acidic in nature, which comes into the mouth, and this causes actually a reduction in the calcium on the, especially on the surface of the enamel, and this enamel becomes very weak. And if they go and brush after the vomiting, then what happens is that enamel just abrades off, or the organic part of the enamel also goes off by using a brush. So one thing I will tell you, the tip to be remembered is, if you have a vomiting issue, don't go and brush after this thing to keep your teeth clean. Please wait for at least half an hour before you go for a brushing. And second thing what you can do is actually to use a cheese or a milk inside your mouth for some time, so that it will actually replenish the calcium which is there. Use of calcium tablets and vitamin D tablets during the pregnancy is also advised, because that will increase the amount of calcium in your blood. And second thing is, it will not take the calcium from the bone and the tissues around your teeth, so that the teeth will become much more strong, which will be kept as strong as it used to be before. So taking calcium pills will be advised by the gynecologist itself. So that is one more thing. The third reason why most of the people fail is basically having some infections and things like that, or even having a caries. Most of the people have, when they have a caries, they don't go to a doctor, because they think that it is not good for them, because they are fearing what will happen if a doctor does some procedure, will it affect the baby and things like that, and all those treatments that can be done during the pregnancy is not known to them. I will be speaking about all these things on another video, but during pregnancy what I will suggest you is, if you are not able to brush in the morning, please brush your teeth after you take a breakfast, or after you are a little more awake. Once the morning sickness is over, you can go and brush your teeth. Please brush after your dinner, so that you brush off all the food and all the debris in the mouth, so that even if you have morning sickness, then your mouth is still kept clean, and then recalcification can happen. And as soon as you are planning to get See, there are people who plan their pregnancy. For that, they go and check their hemoglobin, they check their calcium levels and things like that, and the doctor will say that, okay, you are ready, you can actually try for a baby. Especially when there is an IVF and things like that, they do that. But during that, please go to a dentist, go check yourself whether you have caries, whether you have gum issues and things like that. Please correct it before the pregnancy starts itself. If you are a person who is already pregnant, or if you have not gone to the dentist, please go to the dentist at this point of time, but don't take any x-rays, but check whether there is any caries which is there, which is visually possible to see, and check it out so that there will not be any large problems during the pregnancy. If at all you get an infection during this thing also, you can go to the dentist. He will treat you without giving you much antibiotics, much of a he will not take an x-ray unless and it is very important. So please make sure, unless there is a big cyst which is developing or something which is actually fatal for you, otherwise they will not take any x-rays. They will make sure that there is no x-rays done during the pregnancy, or there is nothing harmful. Even the antibiotics given will be much more safer for your kid and yourself. So all these things has to be kept in mind, so that when you are pregnant, please make sure that you go to the dentist, have a look at it, so that you will not have any infections. Why I am talking about this, if you have an infection in your body, that means that there will be a lot of energy which is spent on that. The body will actually shut down so many things. So the growth of the child also may get affected if you have a lot of infection in your mouth. So please make sure that you go to the dentist, have a checkup done, make sure that there is no infections, tell him that you are pregnant, and then he will advise you what all to be done, so that you will have no infections during this 9 months period. So this is what we will have to do. What all treatments can be done, whether it can be done, all those things will be talked in the following video. Please watch and subscribe my channel. If you like it, press that bell button so that you will get personalized messages as soon as I upload newer videos. Please subscribe. Please send it to all those who are planning to have a baby, or having already, you know that they are pregnant. Please do that. It is completely safe to do most of the simple procedures, but if you want to know more about it, listen to my next video, which is all about treatments during pregnancy. Thank you very much. I am Dr. Thomas Nechupadam from Nechupadam Dental. If you have any queries, please free to have a comment. I will personally comment on what can be done during that. Please send it to all your friends. Thank you very much. Dr. Thomas Nechupadam from Nechupadam Dental.
Wikidonist.com